My name is Anna Schick, and I'm the primary therapist at Center for Discovery's adult residential program for women. And I think that when patients come here for the first time, what they all have in common is a great amount of fear. And I believe a lot of that really has to do with the not knowing piece, not knowing how they're going to be treated, and really not knowing how they're going to cope without their behaviors. Most people who come here have been dealing and struggling with their eating disorder, either for a couple of months or for years. Some have been in and out of many treatment centers and have relapsed. For those who come in, there is a sense of, is this going to work again, or can I do this again? For others, this might be their first experience in residential, and the fear really is, I have no idea what this is going to be like, and how am I going to cope without my behaviors? Because again, the eating disorder, the food is just a symptom. The underlying issues, the guilt, the shame, and each individual person's struggle is unique, but all of that really contributes to the need for control. And that really then interprets itself onto the food piece. So for them to really be able to surrender and say, I can't do this anymore, I'm giving up my control, is huge. We know this is terrifying, and we are here. We know we're about to take how you've coped for possibly years away, but we are here to give you new ways to cope, and we're going to be here every step of the way for you. And we're located in Rancho Palos Verdes, California, and we overlook the ocean, and we're really in quite a serene and beautiful part of California, and a really tranquil place, I believe, for people to really come and be able to recover with lots of nature around, and really just a place to start the healing. This is an uncomfortable and scary process at times, but we are here to also let you know that we're here to guide you through the process and to really start to address the feelings that might be overwhelming to do on your own, and that there is hope, that there's hope here to be able to work through those feelings and not let them overwhelm you. We see a lot of clients coming in with a lot of shame, guilt, anger, and really a lot of fear to just begin their treatment process. And we really welcome all those feelings here. We validate it, and we are here to walk through the treatment process with you. You are not alone, and you no longer really have to do this alone. So if you're someone who is ready for treatment, knowing that we are here, this is a place where you can do it in a nurturing way with people who do care and understand and will validate you every step of the way. A lot of the times our clients experience conflict within families. They realize that the impact of the eating disorder is now not just affecting them, but it is affecting every family member, where they're isolating and their friends no longer know how to relate to them. And part of that is the distancing piece. People who have eating disorders want to distance and keep the secret of their eating disorder. In our program, in the Adult Women's Residential Program, we incorporate family therapy as part of our treatment. Families are welcomed into sessions, and it really allows each family member to share the impact of the eating disorder on them, their feelings about the client's behaviors, and it also gives the client an opportunity to really begin to express some feelings that they might have been holding on for many years toward particular family members that they are not comfortable expressing. And we really offer an opportunity to just begin this new way of communicating with each other. So there is more understanding. So families can understand how to support the client who's struggling. And so the client can also understand how to use their voice in order to ask for help. That's a big part of our program and really crucial in the treatment.